Okay, thank you again. Welcome again to today's webinar. I hope everybody is home and safe. So today, we are graciously, okay, come on now. It's always something, huh? Okay, here you go. We are graciously sponsored by 305 West End Assisted Living. If you need any information regarding independent living and assisted living, please give them a call at 914-360-6830 or visit them online at 305westnl.com. We are also sponsored by Aetna Better Health of New York. For information regarding enrollment or managed long-term care program, you can also call Maria Delgado. She's the senior accounting manager at Aetna. Please, you can call her at 646-856-0396. And our last sponsor, it's Encore Health Home Care Services. If you need information about long-term, short, or term care, please visit them at encore.org, or you can call 917-620-7327. Today's webinar is about an update on what adult can do and the caregiver need to know about COVID-19, the coronavirus. Our presenter is Dr. Aparna Chopra. So she's a fellow geriatric medicine division of geriatric or palliative medicine at Weill Cornell Medicine. She will share the latest medical guidance on the COVID-19 coronavirus. Some of you might know about PSS, but just a quick overview about our agency. We are a multi-services agency whose mission is to strengthen the capacity of older New Yorker and their families to thrive. We offer multiple educational training and other program online, such as the webinar we have been doing for the last 2 months to stay connected with our community and provide information, helpful information to them. We also have 10 local senior centers. Unfortunately, at the moment, they all closed, but we still stay connected with our members by providing online educational training and some wellness classes. So the senior centers are designed to help older adults to stay connected, healthy, and engaged. We also provide services. So that's the one I work under. It's called PSS Circle of Care. Um, we provide free personalized support for those caring for someone who is frail, chronically ill, or has a memory loss issues. We do also provide services for grandparent raising grandchildren, and we do have an apartment in the Bronx. It's a grandparent family apartment. It was the first in United States. It built purposely for the grandparent raising grandchildren. Our coming of age program, it's for people 50 plus to live with passion and purpose. Please, if you have any question, you can comment in the chat box, or we'll try to respond as many as we can. Or also, we do have the option to raise your hand if you want to say something. I can allow you to speak. I just will just unmute you. Um, just a quick reminder about our census. We know how important it is. PSS has received a grant to help ensure complete and accurate census is taken to the community that we serve. The census is important because it impact funding decision for things like infrastructure, healthcare, education, and more for the next 10 years. It only takes 10 minutes to do it. For the first time, people will be able to respond to the census in 3 ways: online, by phone, and by mail. If you reply by today, no one from the census will come to your residence to obtain your response. Census stickers will be sent to residents that have not responded started mid-May through July 2020. Please, everyone, count everybody in your house. That include babies, young children, foster children, and no relative you will live with you. Okay, so it's easy to do it. You can just visit them at 2020census.gov. Dr. Chopra?
Hello, good afternoon. Let me just set this up.
Yes. Great.
Are you able to see this?
Yeah, perfect. Thank you.
All right, wonderful. Thank you so much for that introduction. Good afternoon, everyone. Thank you so much for joining me today. Today, I will be speaking a little bit about COVID-19 and how it's pertinent to older adults and caregivers. This is a supplemental or follow-up talk since my last talk about a month ago. So there are some updates that I'll be providing today. So an overview of my presentation today, I'll be speaking to you a little bit about the epidemiology and the spread of this virus globally, nationally, and locally. We'll be talking a little bit about the concept of flattening the curve, antibody testing that has become available, treatment updates, the self-management of stress, which is rampant during this time, some coping strategies, and at the end, we're going to open up the floor for some questions. So coming to the epidemiology. So this illustration really shows us which parts of the world are most affected by this pandemic. The highest number of cases, of course, are in the US, Italy, and Spain. In the United States, since January the 22nd of this year, there have been over 1 million cases. As you can see from this graph, the 5-day moving average, it seems to have plateaued in terms of the number of cases that are being detected. In New York, this graph shows that there is a decrease in the total number of hospitalizations. It is slowly but steadily coming down. So why was New York hit so hard? So New York is the epicenter of the COVID-19 cases. About 60% of the total infections in the United States come from New York alone, and about 56% of these infections arise from the New York metropolitan area. This is because New York has a very high population density. We are testing a lot more in New York. So if you have higher testing rates, we are bound to catch more cases. There's also a high number of international travelers coming into New York. So let's talk a little bit about flattening the curve. What does this concept really mean? So if I'll draw your attention to this graph. At the bottom here, you see it's the time since the first case or the outbreak. And on the left-hand side, you see the number of cases. The dotted line that you see going through the graph, it's the capacity of the healthcare system. So really, flattening the curve brings into the picture the concepts of taking the right measures, such as social distancing and home quarantining, and the effect that it has. So it really just means that we're trying to prevent an influx of cases all at once that would threaten to overwhelm the capacity of the healthcare system. So as you can see from the purple graph, the total number of cases would rise exponentially within a shorter amount of time, and it surpasses the capacity of the healthcare system. This is a problem because if there's a lot of patients who are seriously ill, then they would likely need more ventilators, they would need just more care in the hospital, more than they would be able to provide or support. Now, if we take the total number of cases over time, they would likely remain the same, but what these measures of social distancing and home quarantining would do would be to spread these cases out over time. And this would allow the healthcare system to really be able to manage the number of cases. So we're not, in summary, we're not trying to reduce the total number of cases, we're just trying to spread them out. So at my last talk, we had talked about how the CDC had recommended that You only wear face masks if you are ill or you're exhibiting symptoms to protect others around us. So since then, there are some states where it has become mandatory to wear masks in public areas. This could include surgical masks, or more often, it's going to be a cloth face covering because there is an acute shortage of PPE. So the states include New York, New Jersey, Connecticut, Rhode Island, Hawaii, Pennsylvania, Illinois, Maryland, Oklahoma, Michigan, California, and Texas. Since my last talk as well, the CDC has added 6 new symptoms. So previously we had heard about the fever, cough, and shortness of breath. However, there are additional symptoms that may appear within 2 to 14 days of exposure. These include chills, repeated shaking with chills, muscle pains, headache, sore throat, and a new loss of taste or smell. However, older adults present with unusual symptoms, which are very important to recognize. They may have an altered mental status. They may appear confused or delirious. They complain of profound lethargy or fatigue. As a result, they may have frequent falls. And they also have more GI problems like nausea, vomiting, and diarrhea. What should you do if you think you have COVID-19 symptoms? Most importantly, you have to stay home and self-isolate for a period of 14 days. If you are around other people in your home, you must wear a mask or a cloth face covering. You should frequently sanitize high-touch surfaces. If you are having more acute symptoms, you should contact your PCP or a local healthcare provider, and you should monitor your symptoms. If you develop shortness of breath, persistent chest pain or pressure, confusion, bluish lips, you must go to the emergency department. When can you discontinue home isolation? Well, there's a test-based strategy and a non-test-based strategy. If you do get tested positive and you are using the test-based strategy, you must wait until you have a complete resolution of fever for at least 72 hours, improvement of respiratory symptoms, and you must have 2 negative COVID-19 tests at least 24 hours apart. However, since testing is not widely available, we usually adopt the non-test-based strategy, which means that you must wait at least 7 days since your symptoms appeared, and at least 3 days since the resolution of fever and improvement of other symptoms before you can go outside. If you think you've had known or suspected COVID-19 exposure, you have to monitor yourself daily for symptoms. This includes fever, cough, and shortness of breath, as well as the new CDC symptoms that have come out recently. You should avoid public places, self-isolate for 14 days, sanitize high-touch surfaces, wear a mask or cloth face covering around people, and practice social distancing so that you maintain at least 6 feet distance from others. So now we've been hearing about the antibody tests, which have become available. The use of these antibody tests is really to identify the infection rate. We know that there is a lot of people who are asymptomatic, who may not present with symptoms of infection, but have in fact become infected and have developed immunity to it. So this test would help to identify the infection rate. It would also help to identify those individuals who can donate plasma, because convalescent plasma treatments are being analyzed in some of the clinical trials that are ongoing for the treatment of this infection. It's important to remember that there is no guarantee that even if you possess antibodies to this SARS-CoV-2 virus, it does not guarantee immunity against reinfection. So what are some of the treatment updates? There is no cure for this viral infection. However, there are multiple therapies and ongoing clinical trials. So currently, we only have anecdotal evidence. So infection prevention and control measures are our best friends. Treatment really involves around supportive care. This includes supplemental oxygen, IV fluids, and in very severe cases, mechanical ventilation. Some of the medications that have been used to help with the treatment of this, this illness, this is more supportive care again, since there is no cure. There is no evidence for or against the use of remdesivir, which was a drug used to treat Ebola virus infections, convalescent plasma, and something called interleukin 1 and 6 inhibitors. The NIH actually recommends against the use of hydroxychloroquine and azithromycin combination because it can lead to potential toxicities, as well as the HIV drug lopinavir and ritonavir. Sorry, I believe I skipped a slide there. So there is a vaccine in development. However, before a vaccine can be administered safely, it must undergo multiple phases of testing. It can take up to 1 to 1.5 years for this virus or for this vaccine to be developed and come into circulation. So it should hopefully be ready by next season. The reason why we are so hopeful for a vaccine is because it confers something called herd immunity. So herd immunity is when a significant proportion of the population has either been vaccinated or have become immune as a result of clearing the infection. And this results in protection for susceptible individuals. So this virus is actually known to be very easily transmissible. So one person can potentially pass on this virus to 2 to 3 other people. So what would happen is, instead of, so if there is a significant number of people who are, of susceptible people who have now become immune, this virus would not be able to be passed on so easily. It would not be so easily transmissible. So one person could potentially pass it on to one other person. And this really allows the spread of this disease to become stable over time. So because of this pandemic, there has been a lot of stress, whether this is economic stress. We've been hearing about the unemployment rates skyrocketing. There's millions of people across the US who are unemployed. There's a lot of psychological stress. So how should we manage this stress? First of all, we should name the emotion. So fear. Fear can be caused by misinformation and rumors. And facts serve to minimize fear. So we should arm ourselves with knowledge from credible sources. This includes the WHO, the CDC, the NIH, and your local health body. So our response to fear is an interesting thing. So we could either have a healthy response to fear or an unhealthy response to fear. The healthy response would be if we arm ourselves with knowledge, take action, and stay safe. An unhealthy response would be inciting stigma and panic, which ultimately leads to rejection, exclusion, and acts of discrimination. And this is what we want to avoid at all costs. So we should focus on what we can control. We should find social support, follow CDC guidelines, be gentle with ourselves, try not to compare yourself with other people, find ways to help others. This can actually prove to be extremely rewarding. Prioritize self-care and seek professional help when necessary. Given that most of us are now working from home, it's very difficult to maintain routines, but it is extremely important that we incorporate a balanced diet, find time for physical activity, maintain our supportive relationships, adopt mindfulness practices, take care of our mental health, and of course, get a good night's sleep. So there's this app that I came across called the CBT-i Coach App. This was designed for veterans and active duty personnel, as well as civilians who are experiencing insomnia. It can actually be used as an educational tool, and it's a free app that can be downloaded from the App Store as well as Google Play. So if you have a smartphone, you can download this app. I went ahead and downloaded it, and I have to say it's extremely, extremely useful because there's certain tools available that allow you to maintain a sleep diary. You can take some self-assessments to see how well you're sleeping at night. There's some relaxation and breathing exercises as well as visualization exercises. So the app actually talks you through these, and it's extremely soothing. What are some unhealthy practices that we should stay away from? So the negative coping strategy would be to resort to things like alcohol and drugs. While they may help to temporarily alleviate or numb the pain, our problems don't go away. And then at the end of it, it can be very harmful and lead to long-term problems. Overeating is another issue. A lot of people try to find comfort foods that help them during times of stress, but this can lead to them becoming overweight and again, having long-term health issues. Avoiding our problems never makes them go away. It's important to remember that. It's important to talk to our friends, family, relatives, but if we find that we're venting a lot of negative thoughts, this can actually prevent us from moving forward. So it's important to check ourselves and make sure that we're not venting a lot of negative thoughts. Overspending is a big issue. Retail therapy might feel good. However, during these tough economic times, we really should keep a track of our budget, our spending, and try to curb overspending. And sleeping too much. While it's good to get a good night's sleep, sleeping too much to avoid our problems, again, won't help them go away. So it's all about finding that balance. So how long is this going to last? That's the question on everyone's mind. The problem is there's no clear finish line, and this really causes a lot of stress to a lot of people. Social distancing should continue until the number of new cases in the country as a whole starts decreasing. This will require aggressive contact tracing so that it becomes easier to pinpoint the new cases easily. And also we need to be constantly vigilant and cautious as states start to reopen so that we prevent a second wave of infections that could potentially prove to be worse than the first. I draw your attention to the Spanish influenza. This occurred between the years of 1918 and 1920. This was a viral infection that triggered bacterial pneumonia. It infected over 500 million people during this time worldwide, and it killed more than 50 million people. It occurred in 3 waves, as we see here. The second and third waves were actually deadlier than the first. And there was no cure, only symptomatic treatment, as is the case in a lot of viral infections. So another question that's frequently asked is that will warmer weather curb the spread of the virus? So there was an interview with Dr. Anthony Fauci that I found on YouTube, and he said that it's not an unreasonable assumption that in the warmer weather, the virus will do poorly, but you don't want to count on it. So the message here is we have to do what we can in terms of social distancing, home quarantining, and do our part to prevent the spread of this virus and not become complacent because we're about to get the warmer months. In the future, with enough experience, we may be able to prevent an outbreak, but this would require isolating, identifying, and contact tracing. So the focus until now has been all on containing the spread, but we really have to mitigate it as well. And this is where contact tracing comes into the picture. This is a core tool of public health. Its purpose is to identify known cases of COVID-19 and their contacts in order to isolate them from healthy individuals for a period of 14 days. The potential release of physical distancing restrictions must occur in a staged manner rather than all at once, so that it prevents a resurgence of new cases. This will require a large amount of contact tracing and virologic testing. As you can imagine, this is an arduous task, but it did prove useful in the SARS epidemic. So how does this process occur? So we need a large contact tracer workforce. They have a series of questions that they ask, including the duration of symptoms, the names of close contacts, the place of work, and they try to do their best to ensure that privacy is maintained for these COVID positive patients. According to the Johns Hopkins University, we need at least 100,000 additional public healthcare workers who can help with this task. To become a contact tracer, there is no centralized approach. You can contact your state or local health department as well as the CDC. So contact tracing is occurring already in a number of US states, but there's also been some countries like China, Taiwan, South Korea, and Singapore, where contact tracing has been extremely helpful. There are some contact tracing apps that are in development by companies like Google and Apple. They're based on Bluetooth connectivity because this is the best way to enhance privacy. If a smartphone with the downloaded app comes in contact with a known COVID positive patient, it sends an alert to all phones in close proximity. So you can take the measures to self-isolate and quarantine. The drawback is that it requires widespread participation of individuals. So a lot of people need to be downloading this app and using it. And one of the factors that could curb this is privacy concerns. Also, we would need to own a smartphone. So this may include vulnerable populations, such as those living in poverty, the homeless, as well as older adults. So this brings me to the end of my presentation. I'd like to open up the floor for any questions you might have.
Thank you, Dr. Chopra. They have we have two. Okay, one second. Pablo, if you have a question, you can go ahead and unmute your mic. We have somebody, LM. You are on mute, so you can go ahead and unmute yourself.
Okay, yes, thank you. Thank you for the wonderful presentation. I just want to clear up something. This is where I get confused on. So the antibodies are people who have been exposed to the COVID, develop antibodies, but that doesn't mean that they couldn't. That doesn't give them immunity, I think. Is that what you're saying?
Yes. So that's the new issue that's come up. Most viral infections, such as the seasonal flu, if you do get the infection, you would have immunity for up to a year and a half at least. However, with this particular virus, because it is a novel virus, they're still studying it. They don't have enough information to say for certain that someone who's already had the infection could not contract it again. There have been some cases, I believe in South Korea, where patients had initially tested negative and then tested positive again. But these studies are all ongoing, so we cannot say for certain.
Okay, so we don't. Okay, so we don't know. It could be. You could have immunity and you could not. We just don't know.
Exactly.
Okay, and then and then I'm sorry, I didn't quite understand the herd immunity. Would you mind just sort of?
Absolutely. So say there is a large pool of susceptible individuals where these are just individuals who could potentially contract the virus. So this virus, they have studied it to the point where they think that one person can actually spread this viral infection to 2 to 3 other people. So if you can imagine, those people would spread it to 2 to 3 other people again. So it would be an exponential spread because you have so many individuals who are susceptible. These people have never been exposed to this virus. They have no immunity against this virus. So you have a large number of people who could potentially contract it. Now, what would happen if we actually have an effective vaccine is that if we're able to vaccinate a good number of people. It doesn't have to be 100%. Again, those are some calculations that epidemiologists do to figure out what's the magic number. How many people at least do you have to vaccinate before you have this herd immunity? But say we vaccinate at least 60% of these people, or the rest develop the virus at some point and they clear it. So they have some form of immunity against it. That total number of people, the susceptible people, has now gone down. It's shrunk. So the virus can't really hop from one person to the other as easily. So the one person may infect only one other person rather than 2 to 3 other people. So the total over time, the transmission of this virus becomes stable. That's what herd immunity is.
And this is based on two things, that some people get a vaccine, which we don't have, right?
Right. We do not have the vaccine yet.
And then some other people would catch it and develop antibodies.
Yes, some form of immunity.
All right. Okay, so the herd immunity phenomenon can't happen until we have a vaccine.
A vaccine, or a good amount of people become, a majority of people have already developed, either they've contracted the infection and have developed some form of immunity. But rather than that, the better option would be to have the vaccine in play so that, we can confer it without having more people become infected and have to develop this immunity. Prevention is always our key goal.
Right, but people who have had it and have antibodies, you just say aren't guaranteed of any immunity.
You're absolutely right. It's not that they would not have any immunity, but we're not sure if they would be completely immune to future reinfection, because we're really not aware of how this virus behaves over time, whether it's mutating. If there are different strains of the virus. Even with the influenza virus, the vaccine that's available, it protects against 4 different strains of the virus, not all strains.
Right.
So it's not 100% immunity that's conferred with the vaccine.
Okay. Thank you very much for that clarification.
Of
Much
course.
appreciated. Thank you.
Of course.
Pablo?
How you doing, Dr. Chopra? I'm a caregiver. My mom is 65 years old. She's recovering from a stroke that she had 3 years ago. I've let the home attendant stop coming by because of this virus. I'm currently with her full time. What recommendation would you give a person like myself in the care of my mother during this pandemic? I've witnessed on Facebook about 5 people that I know that succumbed to complications of COVID, and they're now ancestors. And I'm in a place right now where it's myself and my gracious girlfriend helping me in providing the caregiving to my mom. The uncertainty is one issue, but also, do you recommend any home remedies in regards to fighting this issue, like keeping up your immune system up, or any other precautions?
Thank you for that question, Pablo. I'm so sorry that, this is a very, very difficult time, and you're doing a great job. I think that in terms of taking precautions, it's more about being very vigilant about trying to prevent the spread of the virus. So definitely try to sanitize all high touch areas. Basically, your mom, she should have a room of her own, and as much as possible, yes, as much as possible, she should have her own bathroom. And as well as any utensils that she might be using, that should be kept separately. Again, anything that we frequently use. And so that's important. She should wear any sort of a cloth face mask, and so should you and your girlfriend, just to make sure, because the virus spreads through contact, especially in the T-zone of our face. Hand washing frequently is extremely important. These are all measures we could take just around the house, and they do help very, very much. Any hand sanitizers you might use should be at least 60% alcohol. Now, other than that, just making sure that, she's getting adequate sleep, because our immune system really depends on, relies on us getting enough rest. So that's very important. Making sure that she's eating okay. A lot of patients do experience very diminished appetite, and with that, their strength diminishes. So it's very important that she's eating well. Just supplement diet with foods high in vitamin C, and even just the vitamin C supplements that are available. So that would be extremely helpful. I am not aware of many other home remedies other than just making sure if she has a cough, tea with honey really, really helps. And that's about it.
Do you recommend any cleaning products that help sanitize like her room? Because I find myself cleaning her room like every 3 to 4 days. I'm using Dettol. I mix that with Clorox and regular disinfectant to clean her room.
Yeah, I think that there's no one particular disinfectant. Any sort of detergents work extremely well against this virus. It has been shown to be very useful. So I think the cleaning products that you're using are all good. I don't have any specific recommendations. That sounds good, actually, Pablo.
Okay, thank you so much.
No problem.
Okay, thank you. Doctor, we have some question on the Q&A box. If you can check on the bottom.
I don't have the box anymore. I'm trying to get to it.
If you click on top,
here.
but I can.
Okay, I see it.
No problem.
Okay, so if you are directly, this is from Simon, if you're directly exposed to the virus from someone who had been sick, caring for them daily, etc., and were asymptomatic, does that help with anything in terms of antibodies? Also, how would getting plasma donation help or not? So that's a great question. So if you are asymptomatic, there are quite a few people who are and actually do have the infection. So so once you do have, when you are exposed to the virus, let's say, your body does try to mount an immune response and develop the antibodies. Unfortunately, we would not know unless we get tested for them. If you're a healthcare provider, a lot of hospitals are allowing for that testing. Otherwise, you would need to contact your PCP to see if that test is available in your area. And that would be the only way to check and see if you have antibodies, and also if you are eligible to donate plasma, the convalescent plasma. This is, to my knowledge, it's more just ongoing clinical trials where very sick people are enrolled in the trial and get the plasma from these individuals who do have the antibodies available. So the antibodies are thought to, the process would be to bind to the virus and try to clear it out of the body, out of the system. So this is basically the mechanism that would help, but not everyone would be eligible for the plasma donation, and I think you have to be enrolled in a clinical trial for it. So I hope that answers your question. Lisette, she asks, what are your feelings on the new drug that is still in the experimental stage? Not sure of the name. I think it's called remdesivir. I think that there was a lot of news yesterday even for this drug, but I think that they were saying that the total duration of symptoms was down to about 10 days or so rather than 15. But the only problem was the data presented in this randomized control trial, there were no significant differences, basically. So I don't believe that remdesivir has been cleared or is thought to be the cure to this viral infection. So I believe there's still more studies that need to be ongoing before we can get more definitive data, but it's still in the experimental stage. Again, you have to be enrolled. You have to be eligible to receive this medication. and while the patient is in the hospital. And then Wanda asks, I am over 60. My doctor's office has just emailed me saying they are now seeing patients for routine appointments and checkups, and they're offering COVID-19 and antibody testing. For an older New Yorker, would you advise staying away from the doctor for non-urgent needs? I think that that's an excellent question, by the way. As much as we can, we should continue social distancing and trying to stay home. So you're right. If you do not have any urgent needs, if you do not have any severe symptoms or anything like that, you really don't need to go into your doctor's office. I think telemedicine visits are also extremely helpful, and they have been over the past few months, just to limit the contact. And in New York, as we know, there are quite a few. There's very high numbers of cases still. So I don't think that you would need to expose yourself if you are asymptomatic and healthy otherwise. Are there any further questions? I hope that answers them.
Yes. Okay, one sec. There's one more. Maria, you can unmute yourself. Maria Zokwe, I don't know how to pronounce your last name, I'm sorry. So if you have a question, you can go ahead and ask the doctor. But if anybody else has any question, if it's easier for you to just add it in the Q&A box. But also, if any question comes in mind after, you can always email it to me, and I'll try to email it to the doctor and see if we can have an answer for you. Okay, there's another one, doctor.
All right, so my significant other's caretaker is not coming, and I'm assuming that role to the degree I can. We are both isolating at home, getting food, etc. delivered, no contact with anyone. Caretaker would shower my significant other, but I can't manage that as I have neck issues, degenerative disease, etc. Significant other is not willing to wash down standing at sink. Any thoughts? Yeah, that's a difficult one. I think that if possible, if it's not possible to really bathe in a shower, then sponge bathing is another alternative, just to try to stay clean as much as possible. I'm not sure. Dr. Reed, do you have any other thoughts?
No, that's a tough one. I agree with your recommendation here.
Yeah. And Simon asks, not so much of a question, more of an announcement, but I can help Pablo with some home care needs. I work for a home care agency. He can help him enroll into the CDPAP program if he hasn't done so yet. So Pablo, if you're there, this was from Simon.
Okay. Yes, I am enrolled in the CDPAP
Okay.
program.
Okay. Great. Thank you for that, Simon.
Thank you for that. So I think Maria had a question, but I'm not sure if her mic is working. But again, thank you, doctor, for a follow-up webinar on this important. Okay, there's another one. Okay, she just added now.
Is the flu vaccine going to be available earlier since they are announcing a second wave of COVID? I actually have not heard of the vaccine becoming available earlier. As far as I know, it usually comes out in the September, October time. I'm not sure if Dr. Reed, you've heard anything about it coming out sooner?
No, we're still in the early phase testing of vaccine trials at this point, so I don't think we can count on seeing anything as early as the fall as much as we would like to.
In terms of the flu vaccine also.
Oh, I'm sorry, the flu vaccine. Yes, I think it will be available in the early fall.
Early
and obviously,
fall,
as
yeah.
advised, advised given the co-occurrence of COVID with the possible co-occurrence of the COVID with flu this fall.
Yes, I agree. All right.
Okay, so the webinar is being recorded. If anybody missed a part of it, you can go back on our website, pssusa.org/resources, and you will see all the past webinar and the one before that. And you can also view this one if you miss anything. And I thank you again, Dr. Chopra and Dr. Reed. You joined us a little bit after. I thank you all for your participation and for doing these webinars for our community.
Is my screen still sharing?
Yes. Yes.
Okay, perfect. So there are a few people I'd like to acknowledge. Dr. Reed, he's my faculty advisor at the Department of Geriatrics at Cornell. Thank you so much for all of your guidance. Ms. Michelle Arnaud and Ms. Shayna Jacques at the PSS Circle of Care, thank you so much for giving me this opportunity. I'm truly appreciative and for helping me set up everything. Thank you so much.
Thank you, Doctor. Thank you, all of you. And everybody, please stay safe, and we'll see you on the next webinar.
Thank you.